If I were to really explain what it is to be a patient surveyor overall, I would say that a patient surveyor is someone with a lot of lived expertise with navigating the healthcare system and really has become intimately aware of possible gaps, possible areas for opportunity. And when I think of my role specifically as a patient surveyor, having noticed and partnered in the past with organizations around areas where I've found there could have been a different outcome, or there could have been a different opportunity to do something better, or even where there could be an opportunity to allow myself or even my children to access a service differently. I'd say as a patient surveyor, my role in that sense has really been around not being the expert, but just being someone who is acutely aware of the opportunities for partnership and what that can look like in terms of an organization in terms of their services or even in terms of their programs that they're offering, and really exploring how, from a patient's perspective, what that might look like, how that might be improved, where there are areas of quality that could be done better, but also where there are things that are being done that, given the opportunity to have that really transparent dialogue where things could be different. And it's not about, looking at solving possibly, or even looking at it as being finding something that's wrong. It's more about the process of how we get to making sure that everyone is feeling safe in the environment that they're in, everyone is feeling cared for in the environment that they're in, but beyond that, everyone is feeling respected, dignified, and that they also have equitable chances around getting the health care that they need. And what that means for me is really just being able to know where your blind spots might be. So a patient surveyor, from my perspective, might be being able to really go in there and having that candid conversations with patients around what their experience of care has been like and how they might see from their own perspective in the organizations that they've been in, where might there be an opportunity to do better? Where might there be an opportunity, to look at something as simple, it could be something that's so incredibly simple, but that could actually make the most biggest of impacts. And without really having that conversation and having that dialogue of understanding of what it's like to access care, whether it be in a program or in a service within a hospital or the hospitals that we go into, it's really, there really might not be the opportunity for others who are responsible for those things to really know what it's like. And I think that for me, being in this unique role, being able to have that ability to connect, through my own experiences and, let people know that it's not about, not receiving services should they choose to want to talk to me or not. It's more about, how are your needs, or possibly the needs of your population, or possibly even the needs of others around you and your family, being served in a way that you feel are necessary within your healthcare environment.